Second round of questions, we'll start with Cynthia. It'll be on Medicare. We're all getting older, and that includes you, Andrew. Almost 60% of cancer patients and 16% of lung disease patients are over the age of 65. Some in Congress, we won't name them, have suggested cutting Medicare spending by instead giving seniors a fixed payment or a voucher to help cover their health care expenses. Some are concerned this payment will not be sufficient to cover the cost of insurance, thus reducing benefits, increasing out-of-pocket costs for seniors. Would you oppose efforts to cut Medicare so that older Americans, especially those fighting cancer and lung disease, have full access to the health care they need?
Absolutely. I can't believe that elected officials are seriously considering my grandmother, who's 94 years old, in Warren, Rhode Island, living in a nursing home, that she's going to get a check in the mail for $6,000 and go out and try to purchase health insurance. And she doesn't even have access to a computer or a phone. It's ridiculous. I think Medicare is, first of all, I would just put in a plug again for Democrats. We can thank Democrats for Medicare and Social Security. And I would do everything I can as Maine's next United States Senator to protect and strengthen Medicare. I don't believe that we should, as I said earlier, balance the budget on the backs of these incredibly important social insurance programs. Do we need to take steps to shore up Medicare? Of course we do. Are there solutions out there that are available? Yes, there are, including Part D. Why would we ever pass a law that would prohibit the ability of the United States government through Medicare to negotiate with pharmaceutical companies? We need to reform Part D so that we do have the ability to negotiate for prescription drugs. That'll reduce costs significantly and shore up the program. There are other steps that we can take to improve Medicare and to make sure that it's financially stable going forward. I support putting controls on healthcare and managing it so that there's better coordination among providers. I definitely support putting emphasis on preventative medicine so that we can catch disease earlier and treat it when it's least expensive. I support programs that will certainly improve the lives of seniors, not only their medicinal needs, but their overall health needs. I think seniors who are living at home are happier and do better. I support the funding of some of the programs we'll probably talk about later. There's a market basket of things that we can do to reduce healthcare costs, but cutting Medicare is not smart, and I will do everything I can to oppose cutting that program.
Andrew.
I think it's absolutely a disgrace, and I say this as a libertarian, we're supposed to want to cut everything, for politicians in DC now who are cowards about doing anything to either do sequestration, which might affect these things, or not realize that the people who've paid in now, Social Security, Medicare, aren't entitlements. They aren't. And to discuss them as such is a disgrace. However, that doesn't mean it's verboten to discuss how we might turn Medicare and Social Security and allow people who are currently getting out of, say, college or are in their 30s to have choices on how they look after themselves when they get older and when they get out. That's not a problem. Suggesting that we balance the $16 trillion debt on the backs of Medicare recipients and Social Security people is not only unfair, it's disgraceful, and it's against natural justice. And I think no one in this country should abide by that sort of behavior and/or scare tactics. However, that said, I'm always very uncomfortable with having bureaucrats meddling in people's health care and deciding their fates. Now, I know everybody talks about faceless people at healthcare companies. However, bureaucrats only look at numbers, they don't look at people. They have a very bad reputation at doing that. And I think we should be very wary before we give more power to government when it comes to individual health care and looking after individuals as they get older and as they reach their adult age. Thank you.
Angus.
The Ryan budget depends to a significant extent on its efforts to balance the budget, which it doesn't, by the way, even by 2040, on voucherizing Medicare. I think the new term, the voucher, Frank Luntz must not test well, so they're now calling it, what is it?
Premium support.
Premium support. That's a voucher. It's a terrible idea. It's a terrible idea for two reasons. One, it's a terrible idea, as the reason that Cynthia pointed out, to think that elderly people are going to get this check or get this voucher, and then they're going to go out and shop. And I mean, have you looked at some of these forms? I mean, it's very difficult for anybody to figure out. And then secondly, because the vouchers would grow at a lower rate of inflation than healthcare costs, inevitably, seniors would end up paying a larger share of their healthcare costs. The estimate, I think, is $6,000 a person over a period of years. So I think it's an ideologically driven idea. I don't think, and it also helps them on their idea to balance the budget without any revenues, but it's a terrible idea. Now, we do have to control the cost of healthcare generally, and again, I'm sure we're going to get into that at some point, but there is buried in the Affordable Care Act some provisions that may turn out to be the most important part of the bill, which are pilot programs, two of which are in Maine, to develop what are called accountable care organizations for Medicare recipients. One is up around Eastern Maine, one's down here centered around Maine Med. And the idea is for the payors, the insurers, and Medicare, to pay the providers a set fee for a population and say, keep these people healthy. So the incentive is for preventative and primary care rather than volume and procedures. And I think that's what we have to do, ultimately, to change the dynamic of healthcare cost growth. So in the Affordable Care Act, there is this accountable care organization pilot program, which again, as I say, I think ultimately, looking back 10 or 15 years from now, may turn out to be the most important part of the bill.
Steve.
Thank you. I also oppose any and all reductions relative to Medicare and Medicaid. I think for many in this room who are healthcare professionals and are associated with various organizations here, realize it's not a revelation to declare that preventative care is more cost effective and it's more important than treatment care. And to me, that applies to the entire continuum of life. So it addresses everything involving this issue, not just Medicare and Medicaid that affects our seniors. From my work in terms of last year, my company conducted 242,000 health screenings across the country. We run programs in virtually every state. I think we were in 48 states doing health and wellness, biometric testing, screening programs, glucose, cholesterol. And in real world practice, not political theory or abstract theory or Washington theory, I see every day how important investment and awareness is in terms of preventative care. My perspective is on this issue that in a very simple and kind of a simplistic analysis, we have on one side of the equation, every single American is a patient, from prenatal to senior care. Nobody's exempt from this. This isn't a special interest. This isn't, we can talk about Solyndra, investment in energy and some selective things, but healthcare is common to all of us, and I think that's why it becomes an immoral imperative in terms of how we address it. If on one hand we have 300 million patients, and on the other side of the continuum we have doctors, medicine, institutions, I believe we need to focus more on the middle section where 47% of the cost of healthcare and all these programs is typically involved in the transactional phase of insurance companies and administration. And it's big business. And I think that we just need to take a smarter approach, because I think on one hand, America should be proud because we are the most innovative country in the entire world in terms of developing medicine, developing care, patient care, technology. And we need to look at the middle as opposed to trying to take out our fiscal problems on some of our more vulnerable Americans being seniors. Thank you.
Thank you, Steve. Danny.
I don't like to pretend that I know as much about the healthcare problems in this country, and how it all operates, than some of the other constituents. I don't. My background's in the federal government, working in a lot of different agencies, and my focus during this campaign is basically to address the waste, mismanagement, misallocation of resources in a lot of the agencies that I work for. So in order to pay for Medicare, because the tax system that we have right now isn't going to be able to afford to fund and come up with a revenue to pay for the Affordable Care Act and for Medicare and the other programs that we have. So we have to address where this revenue is coming from. For me, what's important for the government to do is to provide 4 basic services to this country. One is safety and security. It's very important. The other is make sure we have a vital economy to promote the business environment so that we can have the revenue to pay for the other services. 3 is to have access to health care for everyone, and also an educational system that provides competitive training for our people to be competitive globally. But we do have to have the revenue to do all this. So the most important part that Congress can do at the beginning of the next session is to address tax reform. And I think Cynthia Dill, I think, has a good idea, which is the financial transaction tax. Some of the experts that have talked before Congress have come up with a value-added tax, which is makes our country more competitive globally, and makes sense in the long run if you combine that with something like the flat tax. That's what we need to do, is to come up with the funding for these programs. As it was said, preventive care through the Affordable Care Act might save us 40% in the long term. Most physicians, from what I've read, want something like a single-payer system or the public option that streamlines our ability to administrate these insurance programs.